cardiac surgeon has endless questions to solve, to find a solution for the decision making in front of a patient. Is probably more what we don't know than what we know. And traditionally the models helping us in deciding type of surgery and surgical approach and so forth were coming from the animal model. Nowadays the animal model is more difficult to study because there is extensive protection of the animal. And for my field of expertise, which is congenital defect, it's extremely difficult because it's not easy to find an animal model with a congenital defect. This is quite exceptional, and because of the size of the animal allowed in the lab, a very, very small animal not suitable for cardiac surgery. Therefore, the interest has been moved towards the mathematical and computational fluid studies, because we can have the answer to our question from the mathematician, engineering, bioengineering, providing them with the right question and finding the way, then they can study the model based on imaging coming from a true patient and giving us the solution which one is the best surgical approach that we can use based on the result provided by them. Fortunately, it's not the first time. Thanks to my long-standing relationship with Alfio, I had an invitation once in Portugal, and I was the only mathematician in a congress of pure mathematics. Then I had been invited in Italy, in Bergamo, to another congress where there were 2 doctors only, and again it was mostly based on mathematics. This congress is completely different because it's with a full audience and speakers, mathematicians, only 2 doctors. But the theme of the conference is entirely devoted to study heart and circulation. So yes, they are all mathematicians, but they are all involved in studies on the problem that we face every day in the clinical practice. So for me it's a huge, huge revelation, and the best fantastic present I could receive. Because for the first time, we not only discussed by phone call or email or WhatsApp or something like that, but on living discussion for 3 full days with presentation given by both sides, mostly mathematicians, all of them aiming at finding a solution in the problem of the patient with heart issues. 1 every 100 newborn is having a congenital heart defect. So 1 every 100, 10 every 1,000. About 10% of these kids are born with functionally a single ventricle, a single pumping chamber, with a variety of different anatomy. Sometimes it's the right missing, sometimes it's the left, or not necessarily missing, is too small to function or not functional. So we call them functionally univentricular heart. These kids have, without treatment, a miserable life in front of them. 90% will die before reaching 1 year of age. There are different surgical approaches according with the different morphology, the type of pulmonary blood flow and so forth, to allow them to survive the neonatal period and then to treat them in the only possible way, which is to use the only ventricle available to pump the oxygenated blood into the aorta for the body perfusion, and to deviate the blood, which is blue, low oxygen content coming back from the body, directly through the lungs to get oxygen. And this is an artificial circulation because it's using only 1 pump when we need 2. And of course, providing, yes, decent result compared to 20, 30 years ago when these kids were considered inoperable, but still having a not ideal long-term outcome. At this point, I'm studying the univentricular heart for more than 30 years because it's one of my passions, in any possible way to improve the quality of life with different type of surgery, changing the available type of surgery and so forth. And then I decided to study the animals with a single ventricle, which are frogs and turtles, but the turtles are very rare and too expensive, while the frogs are readily available. And the positive side is the frogs are living 25, 30 years, while our kids cannot live 25, 30 years, and at the age of 25 they're still jumping, so that means they're in good condition. And the peculiarity of the frogs is they are born with a single ventricle or single pump each other, managing both circulation, the body circulation and the lung circulation. So there is something good in the frogs. Then I want to learn to see if we can duplicate anything in the management of our patients. And therefore I decided to do this research project, and we are ready to start in a few weeks after 1.5 years of exam, test, documents, application and so forth, because the UK is quite a conservative country. And the plan is to take normal frogs and undertake on them an ultrasound or echocardiography and an MRI, cardiac MRI, to study the functional contractility of this single ventricle, how this single ventricle manages the distribution of the blood to the body and to the lungs to preserve a very good quality of life. And then, once we will have the baseline evaluation by the ultrasound and MRI, and the local mathematician offer already their help to study from mathematical point of view the flow distribution and so forth, then the next step will be to make these frogs hypoxic, cyanotic, reduce the oxygen content, to mimic exactly our kids who are born, and most of them are severely hypoxic from birth, and to see how the frog can cope with this condition. The dream or the plan is to learn as much as possible and see if and how we can duplicate something from the heart of the frog to help our patients. With this project we are in the pure domain of experimental research, and with all the research we start with a question, we will finish with more questions, and we are still far from any potential clinical application. Simply we have to learn, and then we see based on what we learn what we can apply clinically.